Okay, we're going to get started. Good evening. My name is Michael Bayer, and I'll be facilitating this evening's conversation between our two panelists who are going to be speaking about systemic racism in U.S. healthcare. Our panelists are Dr. Brian Williams, who is an associate professor of surgery at the University of Chicago, and Jessica Simpson, who is the founder and president of Loyola University Stritch School of Medicine's White Coats for Black Lives chapter. So thank you both for being here to join us this evening.
Thank you for having us.
So this is part of a 4-part series that's a collaboration between White Coats for Black Lives, Loyola University's University Ministry, the Hanks Center for the Catholic Intellectual Heritage, and a range of Catholic parishes in the Archdiocese of Chicago that have come together to host these conversations on eliminating or working against systemic racism in the US healthcare system. So our topic tonight is systemic racism, and it's important to make the distinction between, personal prejudice or individual acts of discrimination and systemic racism. We may have people who are participating in the series who think to themselves, may even be healthcare providers who think, I would never discriminate against somebody on the basis of their race. But that's not what we're talking about. Dr. Williams, what do we mean when we're talking about systemic racism in healthcare?
Well, thank you for that kickoff question, Mike. And I think you made a very important distinction there when you mentioned individual racism versus systemic racism. And we need to start with some common definitions. First of all, systemic racism does not mean we have a system that is full of racists, right? So systemic race, we're talking about systemic racism, not a system full of racists. So when you mention individual racism, that is one person's bias against some person or group based on their race or ethnicity. And I think most people have a pretty good understanding of what that means. And we're seeing that play out now within our country with our way we vilify immigrants and people of color that is happening throughout the country. It has been going on for the past few years. But when we get to this discussion about systemic racism, that is frequently where the conversation can be derailed. And when we talk about systemic racism in healthcare, it gets even more complicated because we frequently think of healthcare providers as being this group of altruistic individuals who are serving humanity. That still is true. That fact does not change. When we talk about systemic racism, we have to go back into history and realize and recognize that there are structures that have been put in place intentionally to marginalize and discriminate and disadvantage people of color. And they exist within systems, and healthcare is no different. So if we look at our education system, the way we deliver healthcare, and in fact, today there's a really interesting article in the New York Times that discussed how reimbursement is given out for medical procedures and how that disadvantages people of color, particularly in the age of COVID, when many may not have insurance, therefore health systems are not incentivized to treat them because they may not get paid for those procedures. So that is a form of systemic racism. So we're not pointing at an individual saying we're going to disadvantage people of color. We're going to ensure that they cannot get access to healthcare or do not get the treatment that they need, and that they'll suffer from preventable diseases and illnesses. However, the systems are durable. They go back generations, and you do not have to be a racist to benefit from a systemically racist system. So again, individual racism, a person has a bias against someone due to the race or ethnicity. Systemic racism is a result of the structures that are in place that put people of color at a disadvantage.
Thank you for that. That's really, I think it's very helpful, as you said, to kind of define what it is we're talking about. Jessica, last week when we had the Grand Round session, a question came in about what are the physiological effects of systemic racism on Black, Indigenous, and persons of color? How does systemic racism, not just in healthcare, but in society more broadly, actually harm human bodies?
Yeah, that's a great question. So systemic racism affects people in two ways, right? So you have your social impact, and then you also have the physiological impact. And the social impact relates to your income, which can then affect your housing, right? And we know that there have been, and there still are, unfortunately, policies in place that do not allow for people of color to have the same access to affordable health care. They may have a different mortgage rate. This has happened, we've seen this through big banks and companies like that. We've also seen access to clean water be different in areas of higher populations of Black and brown people. Detroit, Michigan is a prime example of that. You may think of asbestos also being something that's within a household. All of those things can impact someone's overall health and well-being, whether it be asthma or lead poisoning, not being able to keep up to public health standards for housing, and it just kind of going underneath the radar because it's in an area where a lot of people are just not necessarily paying attention to, unfortunately. Can also impact the quality of food that's available. So some of you may have heard of food deserts. And that just basically means that there's an area where a group of people do not have access to affordable, nutritious food. So you may look at predominantly Black and brown neighborhoods that have, they don't have a grocery store that offers them fresh produce. They may have a lot of quick marts or like In-N-Out stores and liquor stores and fast food restaurants. There's like a McDonald's in every corner, right? That's also another way in which systemic racism, when we're talking about policies and procedures that are in place within a community. You can also think about what Dr. Brian Williams said, which is health insurance. So having access to affordable health insurance, whether or not that state has expanded Medicaid, for an example. The other thing that's really important is your premium. So depending on the type of job that you have, whether or not your employer has negotiated insurance coverage that you can afford, that also has something to do with who you are as a person. There's research that shows that white males are more likely to have employer offers of health insurance that is affordable and comprehensive for them than Black and brown people. And again, if you're looking at gender as well. You can also look, again, with access to healthcare. Chicago is a prime example with the closure of Mercy Hospital. Mercy Hospital will now impact the people who live on the south side of Chicago. It will leave a 7-mile gap of people who will not have access to a hospital within their neighborhood. And that's, if someone has a stroke, that's something that is time sensitive. I mean, Dr. Williams can talk about that more. He's a trauma surgeon. Time is of the essence for many diseases. And then also just thinking about the physiological impact, right? So stress, dealing with stress of, being racially profiled, of being judged, of being discriminated against on an individual level, that can have impacts on your physiology within your body, because chronic stress can lead to inflammation, and inflammation can be associated with, fatigue, asthma, back pain, arthritis, irritable bowel. It can also affect someone's blood glucose, which makes them more susceptible to diabetes. It can also have an impact on how you're breathing. So some people have difficulty breathing. You can have ulcers from that. And then there are some studies that think that stress and inflammation are also related to cancer. So when we look at these health disparities, it's honestly no shock that Black and brown people are more likely to have hypertension and diabetes, right? I mean, it kind of just makes sense. It's also can decrease your immune system's ability to fight a common cold or the flu or COVID.
Right. So there's a direct line from redlining and zoning to what kind of food people have access to things like obesity, diabetes, all sorts of things. And then you throw in the other things you're talking about, like, healthcare deserts and the distance to a quality hospital and all of that. It's so clearly, and you bring up Michigan, I lived for a period in Ann Arbor, never had to worry about my drinking water. Whereas in
Right.
Flint, a disproportionately non-white community, we've seen literal physical harm. So Dr. Williams, you've spoken extensively on the kind of multiple pandemics that afflict Black and persons of color here in Chicago, one of them being gun violence, but also now we have this pandemic, which has exacerbated and added unemployment. How has the pandemic even caused more of these systems to be present?
Well, COVID-19 has really pulled the curtain back on a number of systemic inequities that have really been hiding in plain sight. And Jessica just touched upon several of them. And it speaks to the importance of systemic racism in healthcare is not just what happens within the healthcare system. It is what is happening before they even get into the system. Now, if we look at how we spend our healthcare dollars, 90% of our healthcare dollars are spent on about 5% of things that we can impact, which are lifestyle changes, exercise, diet. Another 15% that is genetic, which really can't impact that. But the remaining 80% are that impact individual health outcomes are the things that Jessica mentioned. Environmental injustice, Detroit and the water being a prime example, education, criminal justice, housing, food deserts, all those things have a greater impact on an individual's overall health outcomes than the things we treat in the hospital. And so things are flipped in how we spend our money in this country in regards to health outcomes. So COVID, this invisible virus, has just blown it all wide open, where we are seeing that Black people, brown people, Native Americans, Asian Americans as well, are suffering a disproportionate number of deaths from this virus as a result of that being compounded by these other social determinants of health that I, as a doctor, cannot treat. So when you mentioned gun violence and COVID intersecting, yeah, in Chicago, if you look at the maps of where most of the gun violence occurs within the city, those maps overlie where most of the COVID deaths are occurring. When you break down the racial demographics, it's overwhelmingly Black Chicagoans that are suffering the brunt of gun violence deaths and COVID deaths. That is not something that just happens by accident, right? When you have racially segregated neighborhoods that were by intent, as you mentioned, redlining, and then you have, and put on top of that, the environmental injustice, healthcare, food deserts, all those things lead into healthcare inequity. And that when something like this happens, pandemic, gun violence, these communities suffer the greatest burden of that as a result. So what do we do about that is not just treat the problem, not just me operating on gunshot victims. It's about, okay, what do we do upstream? How do we get outside the healthcare system to address those inequities that will have a greater impact on their health? How do we give everybody clean drinking water? How do we ensure that there are no food deserts? How do we ensure that there is access to a hospital within a reasonable distance from where they live? And it goes on and on and on. So when the pandemic occurs, these other issues become amplified, and the impact is that much worse on vulnerable communities.
Yeah. Nothing to add to that. Thank you for the context. So Jessica, you know, I know that you have family in Louisville, Kentucky, and so the murder of Breonna Taylor and the failure to charge the officers, I know, has hit you, as it has hit many women of color, very, very personally, very hard. But it's not just police brutality, which is frequently in the headlines these days. It's many other forms of violence against Black women and persons of color, and one of them, Michelle Godwin, a scholar and activist, highlighted in a recent article for the Hastings Center Journal entitled "Black Women Can't Breathe." And she told the story of 57-year-old Barbara Dawson, who died on the pavement outside of a hospital after hospital workers called the police to forcibly remove her from her room and remove her from her oxygen tank. She died handcuffed to a police car on the pavement, steps from a hospital, and never, this story never became a hashtag. This didn't become a cause that, you know, people, and yet these stories are so pervasive. What are some of the ways in which women of color, particularly Black women, suffer the violence of systemic racism?
Well, that is a loaded question, honestly. And I learned about that incident from reading the article that you referenced as well, and it was heartbreaking. But at the same time, I was not necessarily surprised, because we live in a society where it's just easier for people to make judgments based off of things that they see, because that's just the way in which, you know, we've kind of developed as a human, a way of processing our lives. And so in society, we are constantly making this dichotomy between good and bad, Black versus white, and bad is always associated with Black. And I think people, unfortunately, just instead of listening to people, they make judgments based off of the color of their skin, or the fact that they don't speak English as a first language, or maybe they're wearing a hijab. Like all of these things that are like that they can physically see, they're making judgments based off of that, instead of really asking what's going on with the patient and really trying to, or the individual, and really trying to figure it out. I mean, that's what happens in a lot of cases with, you know, unfortunate incidences with police brutality and murder. There was just recently, and I'm blanking on the city where this occurred, I think it was somewhere in Texas, where someone was breaking up a fight. I think he's a 31-year-old Black male. He was breaking up a fight, and the police officer automatically assumes that he's a threat. Again, I don't know if you listen and
Jonathan
read
Price,
some of the,
yeah.
Yes, thank you. So Jonathan Price was just automatically perceived as a threat, even though in his community he is known as a hero and somebody who is a leader, right? And normally steps in and intervenes in a positive way. But he was a white officer, and he made a judgment based off of the color of his skin and decided that he was a threat and that he was the issue, and then took matters into his own hands because he believes that he has power to do so, you know, tased him and then shot him. That's really unfortunate. It's unfortunate, but using the word unfortunate doesn't really get to the root of it, because it's absolutely disgusting, honestly, that we are still in a point where we're continuing to judge people without even taking the 10 to 30 seconds it takes to start asking questions and figuring out really what's going on, and really believing people too. I think a lot of times, you know, something that my friends and I talk about in the Black community is when we're talking about that we're racially profiled, that we are treated differently. A lot of white people or Latinx people or Asian people or people who are basically not being targeted don't believe us because they don't have that experience, and they think that we're exaggerating. And again, the case of the woman that you referred to, the hospital and the healthcare workers and the police officer didn't think that she was actually telling the truth when she said she needed the oxygen, right? And really, there shouldn't be a debate, because if you're in a hospital and you're checking someone's vital stats and you're looking at their saturated O2 levels, you would know whether or not they need oxygen if you're doing your job appropriately, right? But again, unfortunately, we have this lens, and that lens is how we view the world, and it's the way in which we start practicing and executing our jobs. And we see that in healthcare, unfortunately, and we see it in police brutality. And there are stats that show this. I mean, there's data from the government that specifically shows that people who have a bias or preconceived notions, so implicit bias or some sort of stereotype about a group of people, that determines the way in which they gather history. So as a healthcare provider, we normally interview the patient and we ask questions. And we know that history taking is very important when you're trying to figure out what the true root of the problem is, why someone is ill. And that can impact the questions that are asked. It can impact the way in which decisions are made as far as, you know, the type of care and the prognoses and decision-making with treatment. And so implicit bias, unfortunately, makes Black people, and especially Black women, vulnerable. And it can be a form of violence, unfortunately, because when we're talking about health, and especially when we're talking about if someone has a pulmonary embolism or if someone is having shortness of breath, all of those things are time sensitive, and if not addressed in the appropriate amount of time, that the person could die. And that's unfortunately what happened. And it honestly makes it have like a visceral reaction, especially as someone who is a healthcare provider, and the whole point is to help someone, and we take an oath to not do harm, when in fact you're doing the exact opposite.
Yeah, I think
Mike,
yeah, please.
Good. And another thing about that is when an incident like that occurs, like the woman you just mentioned that was handcuffed to the car, I didn't even know about that incident, right? There's ones that we know about, but how many do we not know about? Is it for everyone that we hear about? Is there 10, 20, or 100? Who knows? But every time there's an incident like that, or with Breonna Taylor, or with Jonathan Price, or with George Floyd, we as Black Americans there's implicit and explicit messaging that we need to look at that one incident and wait for all the facts. or there's something that we don't know about the full story. So just take that by itself. But we know that we don't see these as an individual incident. We see the totality of our oral history from our families and friends. We know that this is happening across the country and it's been going on for a long time. So it's not just one bad person who didn't listen to the police officers, or there's something that would justify whatever happened. So we were told to look at it in isolation, but in reverse, when we say, you know what, just consider that there is possibly a systemic issue, right? And we've been very clear that we're not saying that systemic racism means that you have a system full of racists, but there's a systemic issue that is leading to this. Why can't we address that? And it's just frequently just swept away and dismissed. And we are told, not in so many terms, like, look, this particular incident, let's wait for the facts. Maybe they were doing something wrong. Maybe if they'd done this or not done that, things would have been differently. Well, I'm here to say that let's look at the system and let's talk about that, so we don't have to have this discussion anymore. Like, it's pretty clear that these are not isolated incidents. There are systemic issues that are bound, and this is what we need to talk about, not just identify the problem, but how do we fix that? How do we address that so this can come to an end?
Sure, can I also add, because in addition to addressing the fact that this is systemic racism, I think we also need to, be aware of the implicit bias, which is on an individual level. So racism affects us at an institutional, like system level, right? At system level, then institutional level, and then at an individual level. And so if we don't have those policies in place at the structure and institutional level, then we're now just we're relying only on individual people doing the right thing. So what Dr. Williams is saying is very important. If we have the structures in place, the policies in place, then we're not going to have to rely on people. People are unreliable. I mean, this is something that we just know, right? And if you already know in your mind, if you're practicing systematically how you will address every situation and you do it the exact same way, it's something that they talk about in medicine. When you are learning how to, adequately take a history and to perform physical exams on someone, it's recommended that you do it the exact same way every single time. One, it helps you to memorize it as quickly as you need to, because there's just not enough time for all of the information that we need to know. But secondly, again, this is going to make sure that we're, providing equal care to every person, right? And then again, we're not going to have to rely on interpersonal and implicit bias. But unfortunately, because those systems are not addressed and the policies are not addressed, we are seeing a lot of issues on an individual level that are implicit bias and basically, racism.
So to those points, thank you. Jessica, you mentioned taking a personal history, and Dr. Williams, you've talked about, okay, we need to address this stuff. So a question came in last week from a medical student, which was, in an era in which healthcare is increasingly specialized and healthcare providers are increasingly specialized and focused on, their particular place, how do we get healthcare providers to relearn how to do things like patient histories and stuff like that in a way that focuses on the whole patient in front of them and not just particular organ systems? How do we retrain existing healthcare providers, and how can medical schools be rethinking the way they're training future medical providers?
Well,
Yeah.
Oh, yeah. Who do you want to go first?
Sorry.
Dr. Williams, if you don't mind,
sorry.
but Jessica, if you have thoughts too, yeah.
So this begins with just telling the full story, and that begins with education within medical school. And it's not just doctors; it's if it's a nursing school, if you're a radiography tech, or healthcare involves so many more people than just those that are at the bedside. Administration, right? We all have some impact on the outcome of our patients, and it begins with just telling the full story. Healthcare is a multi-trillion-dollar industry. It is no different than any other big industry out there where institutional racism is endemic and plays out. So there's nothing wrong with telling that story and addressing it and using that to improve how we do our job. To pretend it does not exist or has no impact, that is what's detrimental to our patients. And it's also impacting our trainees that are wanting to go into medicine. And you come in with these idealistic notions of what you want to do, but somehow that gets lost or can get lost along the journey. So what can we do? It starts out with education, and I'm very excited about like Jessica's generation of folks that are going into healthcare, because like y'all just did not come to play. Like, they are very socially aware, they're socially courageous, and they're not taking no for an answer. They're curious, they're pushing the conversation, and they're doing action. Like White Coats for Black Lives is a prime example of that, just stepping up and saying, like, this is something we believe in, and we're going to do that. And it'll be very interesting to see when they start getting into positions of leadership and authority, and they're in the rooms making decisions about, this is going to be our policy, these will be our policies, our strategies, here's who we're going to hire. There are so many different things that impact how we can retrain the current healthcare workers' thought processes about what it means to take care of patients. But it really begins, I feel, with us telling the full story, and that begins with the formal education process.
Definitely. And if I could just add, I agree. I think it begins at the educational level for sure. But I think it also, when we're talking about education, we should also think about, encouraging our students in that 4 years of growing individually as a person too, because I think that is going to help them to approach their patients with more empathy, and having this ability to try to meet people where they're at, talking about cultural competency and making sure that people are educated not only about the pathophysiology and anatomy and pharmacology, but also about different cultures, and learning about the impacts of policies and everything that we discussed in the first few minutes of this talk, so all the public health that's related to that, and epidemiology, and then thinking about the language and how we describe patients, right? Because a lot of times it's this, what we call in medicine, it's a curriculum that is just kind of passed down from generation to generation of, we're the physicians, we're over here, and the patients are over there. And I think if we start building this, tearing down the walls and building a bridge and being more culturally competent in providing, patient-centered care, and being more focused on our patients, then it will be easier for us to start implementing, strategies and policies in place. It won't feel as foreign. I think we won't have such a resistance to it. And then as far as people who are currently in practice, it's hard to teach an old dog new tricks, but I always think that people can learn something from that. And the beauty of being a physician is that we are lifelong learners. So this would be an opportunity for people to say, okay, well, now we're approaching medicine differently. Before it was from an authoritative manner, and now we're focusing on the patient and figuring out how I can improve my health outcomes for my patients, so that way my patients are actually more compliant, and make it easier for the physician as well. So yeah, I think I agree. It all starts with education and what we value. And that is led by the deans of the school, right? So and the course directors, they also need to be on board. If they're not on board with this, and they're not making it a priority, then we're not going to see any difference. We won't see a difference. And if they don't understand how to incorporate health disparities, public health, equity, diversity, and inclusion into their curriculum, then they should ask the experts and take a note from the experts and let the experts lead. And also ask students, especially students of color, who go to the doctors with their family members. I do that for sure, to make sure, again, that they're being treated equally. I know the questions to ask to make sure that my aunt and uncle are getting the appropriate care that they need, right? And that they're not being treated differently. I mean, there's studies that show that Black women are not treated the same with their OBGYN, and that when they have a Black provider, they are, treated with the utmost care, right? And they have better health outcomes. So if we can try to get everyone on that playing field, where again, no matter who you see, you provide the same care the same way, and you're conscious about it, right? So again, that goes with growing as an individual. Are you conscious? Are you mindful? Are you not only a knowledgeable physician, but are you an empathetic physician? Because that that ultimately is a reflection upon you for your patient outcomes. And we don't talk about it that way. We always blame the patient. We say we have difficult patients. It's like, no, actually, it's not a difficult patient. It's that you're not taking the time to really ask your patient the questions that need to be asked.
So Jessica,
Let me add to that, Mike.
Yep. Yeah.
So when Jessica talks about the different outcomes when Black patients have Black doctors, what you should not infer from that is that white patients should only get white doctors. Black patients should only get Black doctors.
Yeah.
Hispanic patients only get Hispanic doctors. That is not the message there. The point is that having that racial and ethnic diversity within healthcare, and be all sorts of diversity, gender identity, gender, just go on and on. That makes the entire collective much more aware of the variety of patients that they will see. So yes, those one-on-one encounters definitely improve. That's been shown to be the data, but also the systemic change has been shown by data to improve as well. So that's really the take-home message there, is that by embracing that sort of racial and ethnic diversity within those that are providing the care, also clearly benefits the patients for sure, but it also benefits the institutions.
Definitely. It's about being culturally competent. And thank you for clarifying that.
That's great.
No, we're on the same team, Jessica. We're on the same team.
So both of you talked a lot about the importance of education to changing these systems. And you know, Jessica, you've spoken publicly about the fact, I mean, you're a medical student, you're a full-time medical student, and even within your own institution, you don't always feel supported as a Black woman, and that some students of color might fear retaliation if they speak out about their firsthand experiences. What can administrators, leaders in these medical schools, nursing schools, PA, PT, OT, what can anyone on this webinar who's watching be doing to better go out of their way to listen to their own students before we even get to changing the patient experience?
Sure. I would also say that at Stritch, the dean of my school, Dean Marzo, has been extremely welcoming and encouraging to listening to student feedback. So I think the reason why, White Coats for Black Lives is able to do the work that it is able to do is because we have support from the dean of our School of Medicine. And I think that's very important. Talking to other students in the Chicago area who unfortunately do not have the same support, and it's not just Black students, it's anyone who's interested in talking about Black Lives Matter issues, because unfortunately that phrase has been politicized. So, but yes, I think it's important for, deans of schools, presidents of schools, VPs of schools, the board of trustees, all the people who have power within an institution to listen to their students, especially when petitions are sent and there are substantial numbers of students who are signing, agreeing that there are issues that need to be addressed. Nobody is perfect, no institution is perfect. And if we want to make meaningful change, that's going to require us to do something different, which means we're going to have to think outside the box. And, a lot of times young people just have a different way of looking at things. It's just by generation. And so I think, and also sometimes we have a fresh eye because we haven't been doing this for very long. And we have a different lens. And I think some of our ideas may not be realistic, but it's important to at least start thinking outside of the box on how we can address these issues, because doing the same thing over and over again is not going to achieve different results. We're going to be in the same situation. And that's another reason why I think it's important for us to publicly recognize that racism and systemic racism specifically is a public health crisis, because you can't solve a problem if you don't know what the problem is and you won't acknowledge the problem. That's the only way to start having meaningful solution-oriented conversations. It's also important to have meetings that are solution-oriented, right? And not just having meetings for the sake of having meetings and thinking, okay, well, we're going to have this coalition and we're going to have meetings with students, but then no action actually occurs. It's really important for there to be action following meetings and following emails. Emails are great, but action has always spoken louder than words, and it will continue to do so. So if we want to change a culture within an institution, we need to listen to the students who are experiencing it, and we need to listen with an open mind. and an open heart, honestly, because a lot of times, especially for groups of people, and I'm not speaking personally, but just from listening to other people talk about this, because it's, it's not only happening in the Chicago area, this is happening all over the United States. I read an article the other day about a student at Harvard Medical School and talking about how, she feels as if the institution just uses her as like a trophy, right? Because she's the first Black student to become the president there. And so, but they're not really addressing the needs. This is what happens at institutions where we use, unfortunately, Black and brown people as trophies, and we put them into our messaging and on our websites, and we'll get like the 5 Black students on the website and use the same students over and over again, but we're not really increasing the numbers. We're not actively recruiting them. We're not making sure that there's equity, right, and not equality. When I talk about equity, I mean providing those specific groups of people with the needs that they need, right? And a lot of times for poor and Black students and brown students, Latinx students, or LGBTQ students, their needs are different than other students who are wealthy or students who are white. And so it's important to provide them with funding, maybe scholarships, right? Providing them with funding that they need in order to be successful and thrive as a student. Preparing for board exams, for example, giving people access to different resources that help them to study in a more efficient way. These are all things that don't normally happen, and they're new and different ideas. And I think it's just really important for people of leadership and power to listen first and foremost, and then to start making meaningful change. And I know that that's going to require money, but I think it's important to prioritize Black people and brown people, because diversity makes all of us better. Having women in the room and other folks of different backgrounds can enhance us as an institution and individually. And so it's time for institutions to start making diversity a priority and not it being an afterthought, and putting their money where their mouth is, really. I mean, we just need the money. We need funding. You need resources.
So you talked a lot in that about listening. No, thank you. It was a privilege to be listening to you on it. And so this series is a partnership between a lot of different groups, and we have a lot of Catholic churches and perhaps people of other faith traditions too who are involved in this. And one of the things is that Pope Francis actually has made listening a central theme of his papacy, because the Catholic Church knows something about institutional injustice and doesn't always do a great job with listening. And so he has continually called people to listen. And so I hear you saying that that institutions like medical schools, hospital systems need to be listening. And I really want to encourage everyone to think about joining us for our 3rd and 4th sessions in this series, the final of which actually, Jessica, you're at Loyola, which is a Jesuit school, and you talked about care of the whole person. Cura personalis is actually one of the Jesuit mottos for care of the whole person. And our final session in this series, we're going to have several people, including a dean, including a bioethicist, talking about what Catholic institutions like medical schools owe, not just in terms of listening, but actually in terms of reparations. We're talking about a religious order. I'm a graduate of Georgetown University, which only has a medical school in this day because it sold 272 enslaved human beings. And so, we have to be talking about this not merely from listening and diversity trainings, but for someone coming from a Catholic tradition where priests enslaved human beings and sold human beings, there has to be a reparations dimension to all this. So we hope that people will be able to join us for our future sessions on this. Pivoting to a topic where listening is also not usually one of the words we associate, we have an election coming up. And to both of you, I kind of want to ask, these things get thrown around in the media with a lot of yelling around Obamacare and socialism and pre-existing conditions and all these other things. In what sense is healthcare on the ballot this election? Whoever wants to start, just dive right in.
We start from so many places. Like, if you care about your individual health, if you care about the health of people you love, you care about the health of your communities, there's really only one choice in this election. I mean, that has to be front and center on this ballot. We are what are we, in the month 9 or 10 of the COVID pandemic. And the United States leads the world in all the worst ways in its response and the impact on our population, just in terms of lives, right? But those just become numbers. Those stats, they start to, we start to become numb to what that truly means. But these are just people that are dying. These are family members. People are losing their loved ones. People are losing their income, their jobs, this goes on, and this is the intersection of all the things Jessica mentioned as far as the other issues that are impacted as a result of this pandemic. So when it comes to the election, one administration is clearly not responded in a way that prioritizes the health of Americans, that prioritizes the health of the healthcare workers that are on the front line fighting this pandemic. And the other has a clear plan for what to do about that. So irrespective of politics, political party ideology, one thing that I hope that we can all recognize is our shared humanity. Despite your race or ethnicity, your political party, your religion, we talked about Catholicism tonight, we can recognize our shared humanity, that we can recognize we can invest so little to ensure that we are all healthy as a country, as people, and certainly we can do a better job of preserving what we have so that our children have something to inherit better than what we're dealing with now. So yeah, for me as a healthcare worker, it's easy for me to say, yes, it's on the ballot. I think it should be on the part of the decision-making process for any American. And if it is not, then we certainly should talk about that some more, because it's hard to run from the fact that healthcare continues to be a divisive and problematic issue for a large segment of our population.
Yeah, I completely agree with what Brian is saying. You know, Dr. Williams is absolutely right. Really, and actually, as I was listening to you, Michael, I was thinking it's not just healthcare that's on the ballot. It's really our morals. Really, that's where we're at right now. You know, it's we're questioning, have we lost all humanity here? And do we care about one another, right? Because COVID is really a test of that, because it's more about wearing a mask to prevent spreading the disease to others than it is more about protecting ourselves. And so when we talk about, you know, healthcare in the United States, I think it's like 9 or 10% GDP. It's so expensive, right? And we need to address that issue of healthcare and how expensive it is. And that requires us to check in with our morals. How do we want to be as a society? Do we want to be a society that focuses more on profit or more on people? Because, you know, 210,000 people died, you know, and that has a rippling effect on more than the 210,000 families, right? And so, you know, are we comfortable with that? You know, and it's a weird place to be, quite honestly, especially coming from public health and working at CDC for 5 years. Definitely did not expect the pandemic to be going on as long as it did, and especially with the richest country in the world, and the country who normally leads these efforts with WHO addressing public health emergencies. So yeah, you know, it's more than just the Affordable Care Act. It's also insurance, it's public health measures, it's housing, it's systemic racism. It's really on the ballot. And I think now is an opportunity for us to do the right thing here and to vote based on our morals and not on profit, you know, because some people are still doing fine. If you have you know, the opportunity to have a job where you can work remotely, you may not be affected personally by COVID, but that does not mean that you won't feel its rippling effects in other ways, because maybe the person who is bagging your groceries, that person may no longer be here, right? And I think it's important for us to think about everyone and considering everyone when we're voting. It's not just about us anymore. It's not just about us and our household and me and mine and my family. It's really about us as a united nation. So that's my take. And yeah, I'm glad that you asked the question, Michael.
Well,
It's
again, this
important.
series is a partnership between a lot of different folks, and this may come as a shock, including to some of my fellow baptized Catholics, that believe it or not, Catholic doctrine actually insists that universal access to healthcare is a human right. That's a doctrine of the church, and in fact, in 2010, Pope Benedict was giving a speech where he referred to healthcare as an inalienable human right. And how many Americans have actually heard that from a Christian perspective? Very few. Everybody knows where the church
Right.
stands on abortion, but I've heard
Right.
very few people preaching on healthcare as a human right. So I mean, a lot of that is our failure. You talked about the moral issues. That's the failure of many of us who are involved in church work to preach our own teachings, because we've been sucked into some of this culture war and consumeristic stuff. You talked about profit. So related to that specific thing, a question came in that I want to see if we're able to answer. And I'm not sure because it did come in. Someone asked that he's heard that Medicaid reimbursement rates are lower than those for Medicare for similar services, and what could possibly justify that? Are we able to speak to that? It might not be a topic we can get to tonight.
I'm not aware
Well,
of the differences between the reimbursement rates. They're both with government insurance, so I don't know, Dr. Williams, if you know anything.
The medical reimbursement, the complexities are just endless. I'm not sure if I had a choice between spend the rest of my life learning about medical reimbursement, the IRS code, or poking my eyes out. It'd be a hard choice. It is just that complicated, and it shouldn't be, right? Because as you mentioned, Mike, the Catholic Church even says access to medical care is a basic inalienable human right, but we have commoditized it, right? It is now a business. So profit and bottom line tremendously impacts how we decide who gets care or what kind of care they get or how they get access to care. So it has ripple effects. And as again, I mentioned that New York Times article earlier today, it speaks to that of how finances impact care. So now we have this system of care. We have Medicare reimbursements, we have Medicaid, we have private insurance, we have military. I was in the military for a while, so you have that sort of system. We have these multiple systems of healthcare, and depending on where you stand in society, will determine what sort of healthcare you can receive if you can get it. So this brings classism into all of this as well. So it sounds like a simple question, right? Which is, I should say simple, very direct question with an easy answer, but it's really impossible to give a fair answer to that without really considering all these other factors that go into deciding what procedure gets reimbursed at what rate. So like we as a country have to come back and decide how do we value human life? How do we value humanity? And what are we willing to do as a country to invest in the health of everyone? Not pay for everyone's illness. How can we invest in their health? And COVID is a prime example. If we invested just a fraction of what we're spending now, we could have probably avoided much of the death and suffering that we are seeing at this moment.
Yes. As a matter of fact, funding was cut specifically from public health emergency funding. So, if we even just kept the funding that was already available, we would have had the measures in place. We would have had personnel people were let go from CDC, unfortunately, that were doing a lot of the public health work in order to prevent the spread of infectious diseases. So, but yeah, that is it's a complicated question, actually, even though it sounds like it should be so simple, but there's too many confounding factors, and it honestly depends on the patient too, which is just so
We'll put the Medicare Medicaid reimbursement rate, the IRS tax code, and the Catholic Church's code of canon law side by side, and we'll see which one is the most Byzantine to negotiate. So
yeah.
I want to kind of wrap our conversation on this, and thank you to both of you again. I want to give you time to really answer this. Dr. Williams, I want to hear it from both of you, but you wrote a piece in Newsweek talking about, because we've been talking this whole night about systems and structures and things that seem just completely beyond any individual action. And yet you've insisted that individual action not only is possible, it's necessary. So a lot of people who attend these types of sessions, they want to do the right, and they say, what can I do? What can I be doing, particularly to aspiring white allies? And Jessica, you may have had this conversation with some well-intentioned friends. So my question for both of you again is, we've talked all night about structures and systems. What can individual agents do to make meaningful action on all these topics?
Yep, that's very important, Mike, and I'm glad you brought it to that, because it's easy to talk about the problems and all the issues without discussing like what can we do to make sustainable intergenerational change. And as I wrote in the Newsweek piece, I feel individual action is definitely part of that. We have talked a lot about systems, but systems are meant to be durable. They are meant to last, across generations, and without individuals challenging those structures and what they stand for, then change is unlikely. Even glacial change is necessary change. So for individuals that are wanting to get involved with, particularly deconstructing systemic racism and how that impacts large segments of society, particularly when they may not be people that are within your orbit, right? First, it just have to be this curiosity, discomfort, and proximity. So first, you just have to be curious about what that issue is. We talked about education, listening, all those things. Like, just be really curious about things that issues that you may not know about or may make you uncomfortable. Which leads us to the second part: is that discomfort that you feel. That is a message that is telling you something very important. Do not dismiss it. Embrace it and ask yourself, why are you uncomfortable? And then what are you going to do about that? And then lastly, I'd say proximity, not just to individuals that are unlike you, but also the proximity to these different ideas and thoughts that may challenge your worldview. Political ideology is an easy one to talk about, right? Racial justice, just what does it take to educate yourself, embrace that discomfort, and become proximate to those issues. That is what is needed. And that's what I talk about with individual action. There are many things you can do, from just that, all the way up to, you want to go march in the streets, vote, on and on and on, but begins with you being willing to embrace your discomfort and step into areas that you don't know about, and meet up with people that you may not be comfortable being around.
Yeah, I also think that every single person, no matter if you are involved in healthcare or, what your role is as a society, like I was saying before, all of that impacts us. So the way in which our social norms are, constructed, that impacts healthcare, because we are all members of the same society. So if we individually start doing more reflection, maybe meditation, mindfulness, practicing mindfulness. I actually have the book, it's called Dummies, the Dummies book for mindfulness. Because when I didn't know anything about mindfulness, and I wanted to be a more present person, a more present human being. And I also learned a little bit about, emotional intelligence and how I can change my language in order to have better outcomes, because I'm just that person that likes solving problems, right? I mean, that's why a lot of us get into medicine, and that's probably why a lot of you are on the call tonight, because you want to solve problems. You recognize that there's an issue and you want to figure out how you can solve it. And I think each person has a different skill set that they can bring to the table that will help us collectively as a society to move in a more positive direction. But it all begins with being, again, more mindful, more centered, and taking the time to maybe think a little bit more before we move into action or say certain things. And then also, taking that energy and directing it into action. So whether it is protesting, I'm always protesting whenever I have the opportunity to do so, because it's important for people of power and authority to hear the voice of their constituents. You can also call your representatives. Actually, today, as far as the Mercy hospital closure goes, we had a campaign for calling the governor and calling Mayor Lightfoot, and we developed a script, and it was very easy. If you go to White Coats for Black Lives, it's Stritch, SOM. If you look at any of our social media, you'll find that script. It takes less than 5 minutes. That's another way of addressing systemic racism, because again, that is related to policies. And also voting, making sure that you are voting in a safe manner. So whether that be dropping off your mail-in ballot at the local drop-off location, or mailing it back, or wearing a mask and voting in person, but making sure that you're bringing other people along with you. Everyone should be voting. No one should not be voting if they, it's really not, I encourage everyone to vote. And then, you can read different books, right? There's learning about different cultures. I don't know a lot about South Asian culture, so I read about it, and I was fortunate to go to India. I think it's important, again, for us to have cultural humility and recognize that we don't know everything about one another, and to be curious and to read and to put ourselves in places where we feel uncomfortable, so that way we can grow and change, and seeking out that change. So volunteering, and think about why you're volunteering. Dr. Lena Hatchett at our first session talked a lot about, am I doing this because I really want to help people, or am I doing it for myself to say that I'm the type of person that helps people, right? So just, again, being more genuine and authentic, it always comes back to knowing who you are. So journaling, meditating, practicing mindfulness, learning about emotional intelligence. I can't stress that enough. I think it helps us to just be people who are moving from a place where we really know why we're doing what we're doing. And then no matter how tired you are, you're enjoying it and you're loving it, and you have all the energy you can in order to do it. So that's what I would encourage. And, read as much as you can, gain as much as experience as you can with other people who don't look like you, who don't talk like you. And that's just not with race. The same thing with LGBTQ communities, or immigrant populations. It's all the same. We talked about Black people because, of slavery and the history of that, but there are so many other identities that need to be fully addressed with an approach of humanity as well.
Yeah, so there's a lot of individual work to do, and because the civil rights movement, much of the organizing that happened around individual action was communities of faith coming together and organizing individuals to do things precisely what you're talking about, Jessica, a phone drive to let people, representatives, know about things. And so because we really see this as the essential work of faith communities, we want to encourage folks, including if you're not even particularly a member of one, but maybe you're a healthcare provider who's thinking about how could I partner with a church on the South Side, to join us for our upcoming session, which is actually on the role of faith communities in dismantling white supremacy in the U.S. healthcare system. And we're going to be joined by Dr. Shawnee Daniels Sykes, who is actually the only Black Catholic bioethicist in America. She is a wealth of knowledge, and Ralph McLeod, who is the director of the Catholic Campaign for Human Development at the USCCB. Ralph has been doing community organizing. Actually, I think has a Dallas-Fort Worth connection with Dr. Williams, but has been doing this work of community organizing on the ground. And so if you're a church who's saying to yourselves, okay, that all sounds great, but I don't even know where to start, we're going to give you some tips on October 14th. Thank you so much to both of you, both of our panelists, for joining us tonight. Dr. Brian Williams from the University of Chicago and Jessica Simpson from Loyola's Stritch School of Medicine and White Coats for Black Lives. Thank you to all of our participants who joined us on this webinar. If you enjoyed it, we hope that you'll share it with other friends to get these conversations going. We hope that everyone has a safe and good rest of your evening. Wear a mask, wash your hands, vote.
Stay safe, everyone. Stay safe. Thank you, Mike.
Stay
Thanks for
safe.
having me.
Thank you. Yes, thanks so
Thank
much,
you.
Michael.
Thank you. Have a good evening, everyone.